TBI is the leading cause of death and disability for persons under 35 years of age. It can happen without warning to people of all ages and all walks of life. However, in the military, it is an extreme problem by the nature of what we do. A traumatic brain injury occurs when an outside force impacts the head hard enough to cause the brain to move within the skull, or if the force causes the skull to break and directly hurts your brain. Things that can cause TBIs are rapid acceleration and deceleration of the head, such as when you're in a moving vehicle, like in the military. The stress from the rapid movements pulls apart nerve fibers and causes damage to the brain tissue. This type of injury often occurs as a result of motor vehicle crashes, physical violence, or explosions. There are many causes of brain injury, including automobile and motorcycle accidents, blunt force trauma, accidents, or explosions. Cognitive effects that can happen are almost universal. They include short-term memory loss, inability to organize and process information, vision problems, difficulty concentrating, and problems with initiation and abstract thinking. This is an ongoing problem in the military, and as you'll see in my video, we talk with someone who's actually had a TBI. Traumatic brain injury is often a significant health issue which affects service members especially, and veterans during times of both peace and war. The high rate of TBI and blast-related concussions resulting from current combat operations directly impacts the health and safety of service members, and subsequently the level of unit readiness and troop retention. In the VA, the TBI has become a major focus. Active duty and reserve service members are at increased risk for sustaining a TBI compared to the civilian peers. This is a result of several factors, including the specific demographics of the military. In general, young men between the ages of 18 and 24 are at greatest risk for a TBI. Many operational training activities which are routine in the military are physically demanding and even potentially dangerous. Military service members are increasingly deployed to areas where they are at risk for experiencing improvised explosive devices, suicide bombers, landmines, mortar rounds, other explosives, and rocket-propelled grenades. These and other combat-related activities put our military members at risk for sustaining a TBI. So now that you know what a TBI is, let's talk about what actually happens when a TBI occurs. A TBI, when it happens, often causes someone to have symptoms right away. Usually they